In 1025, a book was published in Baghdad. It described 760 diseases, 800 medicinal drugs, and contained the first clinical distinction in history between plague and cholera. It had a chapter on psychosomatic disorders, a chapter on quarantine, a chapter on how contaminated water causes disease, 800 years before Europe officially accepted germ theory. The book was called the Canon of Medicine. Its author was Ibn Sina, known in Europe as Avicenna. It was used as the primary medical textbook in European universities until the 17th century, which means European physicians studied under a man they called a pagan for 600 years. The question isn't why Arab medicine was so advanced. The question is how it became possible and why we know so little about it. To understand Arab medicine in the 10th century, you need to understand what was happening in Europe at the same time. In 10th century Europe, the primary treatment for most conditions was bloodletting. The theoretical framework was Galen's four humors, formulated in the 2nd century AD and unrevised for 800 years. Surgery was considered beneath educated men and delegated to barbers. Anatomy was not studied on cadavers. It was prohibited. Mental illness was explained as possession. At exactly the same time, literally the same decades, physicians in Baghdad, Cordoba, and Cairo were performing cataract surgery, describing pulmonary circulation, classifying mental disorders as diseases of the brain, and building hospitals with separate wards for different conditions. This is not exaggeration. It is documented historical reality, and it has a specific explanation. In the 8th century, Caliph al-Mansur did something that changed the history of medicine. He funded the systematic translation of Greek, Persian, Indian, and Syriac scientific texts into Arabic. This is called the translation movement. Beit al-Hikmah, the House of Wisdom in Baghdad, Hippocrates, Galen, Dioscorides, Ptolemy were all translated, but not merely translated. They were commented on, critiqued, supplemented, and corrected based on new observations. Arab scholars didn't simply preserve Greek science, they developed it. This is a critical point. Europe at the time also knew Galen, but knew him as a sacred authority who could not be questioned. Arab scholars knew him as a starting point that could and should be tested. In 805, the first hospital of the Islamic world opened in Baghdad, the Bimaristan. By the 10th century, hospitals existed in most major cities of the Caliphate, and these were not almshouses. They were medical institutions with specific structure. Separate wards for men and women, separate wards for surgical and medical patients, separate wards for the mentally ill, not prisons, but treatment facilities, hospital pharmacies, medical libraries, students who learned at the bedside, not only from texts. This is a structure Europe would not reproduce until the 18th century. A physician in the 10th century Caliphate was a high-status professional with high income. A court physician to an Abbasid caliph earned a salary comparable to a senior official. Medical knowledge was prestigious, not suspicious, not dangerous, not heretical. This created conditions in which the best minds entered medicine, in which physicians could publish observations without fear of accusation, in which errors could be acknowledged publicly without loss of reputation. Abu Ali Hussein ibn Abdullah ibn Sina was born in 980 in Afshana, near Bukhara. By 18, he was a court physician. By 21, he had written his first major medical work. The Canon of Medicine, 5 volumes written between 1012 and 1025, is not a compilation. It is the first attempt in history to create a systematic medical science. Here is what it contains specifically. First, Ibn Sina describes contagious diseases as transmitted through air, water, and soil, and recommends quarantine. The word quarantine would not appear in European languages until the 14th century after the plague. The systematic practice of quarantine would not be applied in Europe until the 15th. Second, he differentiates tuberculosis from other pulmonary conditions based on clinical symptoms. European medicine would conflate them for another 700 years. Third, he describes 800 medicinal drugs with dosage, method of application, and contraindications. The concept of contraindications as a systematic category, that is, Ibn Sina. Fourth, he includes in the canon a section on mental disorders. Depression, mania, and epilepsy are described as diseases with physiological basis, not possession. Treatment, diet, routine, social support, and, in specific cases, pharmacology. Fifth, he is the first in history to conduct clinical trials in the modern sense. He describes a methodology for testing a drug, testing on a simple condition, observing time of action, repeating the experiment. This is not strictly medicine, but directly relevant. In 1011, Ibn al-Haytham wrote the Book of Optics. In it he proved that vision is a process in which the eye receives light reflected from objects. Before him, including Galen and Euclid, the prevailing view was that the eye emits rays that touch objects. This seems abstract, but it transformed the understanding of ocular anatomy and led to the first systematic cataract surgeries. Abul Qasim Khalaf ibn Abbas al-Zahrawi, who lived in Cordoba from 936 to 1013, is called the father of modern surgery, not because it's a flattering title, because his treatise, Kitab al-Tazrif, contains the first illustrated descriptions of surgical instruments in history. He describes and depicts over 200 instruments. Some he invented himself: scalpels with depth limiters, surgical hooks, probes, catheters, forceps for extracting the fetus in complicated deliveries. He was the first to describe hemophilia as a hereditary condition. He was the first to use catgut, thread made from animal intestines, for internal sutures that dissolve on their own. European surgery would use this material until the 20th century. He developed the procedure for crushing bladder stones, lithotomy, that avoided open surgery. He described tracheotomy technique. He performed operations on the thyroid gland. His treatise was translated into Latin in the 12th century and remained the primary surgical reference in Europe until the 16th, 400 years. In 1242, already the 13th century, but logically part of the same tradition, the physician Ibn al-Nafis wrote a commentary on Ibn Sina's canon. In this commentary, he described the pulmonary circulation, the movement of blood from the right ventricle of the heart through the lungs to the left. William Harvey would describe the full circulation of blood in 1628 and receive world fame for it. Ibn al-Nafis preceded him by 386 years. His manuscript was discovered in a Berlin library only in 1924. Harvey didn't know about Ibn al-Nafis. This is not a conspiracy. It is simply the history of knowledge transmission in which Arabic sources were systematically not translated into Latin from the 13th century onward, as the relationship between the Christian and Islamic worlds changed. This is perhaps the most striking contrast. In 10th century Europe, the mentally ill were kept in church institutions or with their families. Their condition was explained by spiritual causes. Treatment was spiritual. In the same 10th century, in Cairo, in the al-Mansuri hospital, there was a separate ward for the mentally ill, with dedicated staff, with a program, music, baths, walks, activity, with pharmacological prescriptions, opiates for sedation, plant preparations for sleep regulation. The physician al-Balkhi in the 9th century described conditions we would today call depression and anxiety disorder, and distinguished them as separate states with different symptoms and different treatment. He described what we today call cognitive therapy, changing thinking patterns as a method for treating emotional disorders. Aaron Beck would develop cognitive behavioral therapy in the 1960s. This is an honest question with an honest answer. Not one answer, but several, and historians debate their relative weight. In 1258, the Mongols took Baghdad. The House of Wisdom was destroyed. According to legend, the waters of the Tigris ran black with the ink of manuscripts. This is probably an exaggeration, but the destruction was real and extensive. The institutional base of Baghdad science was eliminated in a matter of weeks. Part of the tradition survived in Egypt, Persia, and Andalusia, but the center was lost. In the 11th and 12th centuries, a current within Islamic thought that viewed rational knowledge with greater suspicion grew stronger. Al-Ghazali, the most important theologian of the era, attacked Aristotelian logic as incompatible with faith in his work The Incoherence of the Philosophers. This did not destroy science immediately. Ibn Rushd, Averroes, wrote, "The incoherence of the incoherence in the same century." But the intellectual climate changed. From the 13th century, systematic translation of Arabic texts into Latin ceased. The reasons were political, religious, and practical. The result was that a vast body of knowledge remained inaccessible to Europe. Parts of it were rediscovered only in the 19th and 20th centuries. Ibn al-Nafis on circulation, 1924. Al-Balkhi on mental disorders, systematically studied from the 1990s. Al-Zahrawi is known in the history of medicine but not in general education. There are several lessons this history provides without any invention. First, scientific progress requires institutional conditions, not geniuses. Conditions, funding, status, freedom to publish, institutions for accumulating knowledge. When conditions exist, progress happens. When they don't, progress stops. This worked in 9th century Baghdad. It works everywhere. Second, the history of science is not linear. Knowledge can be achieved, lost, and rediscovered. Ibn al-Nafis described pulmonary circulation 386 years before Harvey, and it did not become part of the European tradition because the text was not translated. This should make us humble about what we consider progress. Third, what we know about the history of science is determined by what was translated, preserved, and included in curricula. Vast bodies of knowledge exist in manuscripts that have not been translated to this day. This is not a conspiracy. It is simply the scale of a task that humanity is completing slowly. Fourth, 10th century medicine was not magic and not mysticism. It was observation, systematization, testing, and transmission. The same principles that work today. Arab physicians of the 10th century were modern scientists in the sense that matters. They trusted observation more than authority. Ibn Sina died in 1037. According to legend, shortly before his death, he freed his slaves, distributed his property to the poor, and began reciting the Quran. According to another account, he was dictating medical notes until his final day. His canon was used in European universities until 1650, 6 centuries. Then it was displaced by Vesalius, Harvey, Paré. People who applied to medicine the same method Ibn Sina had applied 1,000 years earlier. Observation matters more than authority. Al-Zahrawi died in Cordoba around 1013. 80 years later, the Crusaders would take Jerusalem. 200 years later, the Mongols would destroy Baghdad. 480 years later, Vesalius would be the first in Europe to systematically dissect a human cadaver for anatomical study, and reproduce part of what al-Zahrawi had described without dissection, purely on the basis of surgical practice. The history of medicine is not a straight line from ignorance to knowledge. It is a map with different centers in different eras. In the 10th century, the center was in Baghdad and Cordoba. Then it shifted. Then it would shift again. The next video is about how European medicine finally accepted hand-washing and why the physician who proposed it died in a psychiatric institution. Click on screen.